guys, it is Autumn Skylar Does Everything, here to talk to you today about the topic of chronic pain. Now, I've been dealing with chronic pain since I was 16. It all began when I woke up one day and I had a headache. That's normal, that's fine, it happens some days. But the odd thing was, I fell asleep and the next day I woke up and the headache was still there. And the next day, and the next day, and the next day. And for months, I had this headache, and on top of that, I started getting pain in other places, like my neck and my back specifically, but also all over my body. It felt like I was kind of possessed by a pain demon. That probably isn't a good analogy, but it didn't really feel as though I was in my own body anymore because I hurt so bad and I really wasn't able to engage in the activities that I used to really enjoy. So this all started because of a condition that I have called a Chiari Malformation. Basically, the part of the brain called the Cerebellar Tonsils, which usually sit upright against your brainular region, mine drooped, and mine were trying to do a little escape plan down my spinal canal because, hey, why not? I guess my brain was just too dang big. Couldn't be contained. So that was the precipice of all of this, was that condition that I had worsening, and none of the doctors that I was seeing really picked up on it. I mean, even the neurologist that I was going to at the time, that I started seeing because of the headaches, looked at my scans, saw how bad my Chiari was, and said, "Meh, this totally couldn't be causing it." How wrong they were. Just like a month later, had to have emergency brain surgery. Funny that. But the pain didn't stop after I had my surgery, sadly. And in fact, in a lot of ways, it got kind of worse. And, we found out later, 2 years later, that a good possibility as to why that happened was they found that too much bone was taken out when they did my first surgery. They did it to try and make room. But because of another condition I have that causes craniocervical instability, it made it so my head and neck were even more unstable and things just weren't working correctly, as they should. But there was no way that the surgeon at the time could have known this, and it was done emergent. They did what they could to help me. And, I'm still kicking, so something that they did worked, and it stopped me from going into a very dangerous medical place, to put it lightly. So that happened, and I had to go into physical rehabilitation because my legs weren't working correctly. While I was there, I'm going to say about 2 weeks post-op, they started throwing around the term chronic pain as well as psychosomatic pain. Now, for those of you that don't know, psychosomatic pain, it refers to pain that doesn't have a real organic cause. What that means is typically your brain sends, pain signals. That's not the medical term, but that's just what I'm going to go with. It sends those signals when something is wrong. But with psychosomatic pain, you're getting those signals when there isn't something wrong. It's a misfiring. But they're telling me that I could have psychosomatic pain after I just had brain surgery and have been diagnosed with not only that, but a condition where there were cysts in my spine. So there were organic causes. They just doing that and saying la 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 la, those don't exist, psychosomatic. Why? I'm not really sure. But that's just what occurred, and that's just the term that they like to throw around. Now, the pain was really something that was hard to deal with at first because it was so new and I was so terrified all of the time because initially the pain had been something that was screaming at me that something was wrong. And so when the pain continued after the surgery, I kept thinking, there's something still must be wrong. And in a way, I was right because they did take out too much bone, which led to a worsening of certain symptomology. But we didn't know that at the time, and so I just felt so crazy and out of control, and it was really, really hard. And it didn't help that the medical professionals treating me didn't believe I was in pain. They threw around those terms of chronic pain and psychosomatic pain, 2 weeks post-op, but then about 3 to 4 weeks post-op, I had a nurse pull me aside after I had asked for my dose of pain medication that I was allotted every day, and she asked me what the real reason was that I was asking for the medication. Basically, asking if me, 16-year-old Autumn, who is in a wheelchair at this current moment because her legs don't work, is a drug-seeking individual. Someone that has never had any experience abusing drugs beside the good weed, asking if they are a hardcore drug addict that isn't really in pain. That was great. I absolutely adored being treated that way, and I continued to sort of be treated as someone that was over-exaggerating my symptomology throughout the entirety of my stay. Now, after my stay, I had, I want to say about a month before school started, and then when school started, it was so hard. Juggling schoolwork and chronic pain, it is so hard, especially when it's something you're not used to. The way that my mom always described it is it's like somebody is screaming in your ear and you're trying to focus on what's being taught to you, but you can't because somebody is screaming in your ear. And obviously the screaming is an analogy for the pain, and I feel as though it's a very good analogy because that's exactly how it feels. It feels like I can't focus, specifically when I have bad flare-ups with my head, because I can't think. I can't do anything. I am incapacitated. I still have moments like these to this day. 4 to 5 years after the first headache began, I still have these flare-ups where I can't do anything for however long that spike lasts, whether it's an hour, 2 hours, 3 hours. I am not able to be in control. The pain at those moments is in control. And it's really, really hard to be a going on 21-year-old girl who has chronic pain, because I feel alone. And I feel afraid for the future, because if I'm already in chronic pain and dealing with all of this now at the age of 20, what's the rest of my life going to look like? Am I always going to be in this much pain? That's something that's constantly running through my head, and am I going to be able to handle that? And what if it gets worse? I mean, some days it feels as though I wouldn't be able to handle it if it got any worse. And that's scary. That's really scary, and it's a very, very lonely state to be in because there aren't many people to talk to about it, and especially people my own age. And I know that there are individuals online and there are support groups, but I am also hesitant to join those because I feel as though I'd be complaining. I mean, even making this video right here, right now, a part of me feels as though I shouldn't make it because I'm just complaining and nobody wants to hear that. But I recognize that in reality, even though I am sharing my story and some of them are complaints about the state that I am living in, the intent is not to complain or gain sympathy, but Maybe to make somebody that is struggling with something similar feel less alone, because you're not the only one that has to deal with this. It's so hard to try and feel like a normal young adult because I'm not. And I'm scared every day about having a pain spike. When I make plans with someone, I'm flipping a coin if it's going to be a good day or a bad day. And sometimes I feel trapped in that I can't cancel the plan, so I kind of have to go and, white knuckle it, just get through it, because I don't want to disappoint anybody, and I also don't want anyone to see me as weak or, not normal. I don't like having there be reminders of the fact that I'm not a typical 20-year-old girl. And I know that there are probably a lot of people that can relate. But overall, chronic pain is something that affects me day to day. And I have to make conscious decisions and put in so much effort to fight through it. Even sitting here doing this video, I am in pain. And I want to stop, and I just want to lie down and turn off all of the lights and just drift away into nothingness for a little while. But I'm not going to do that because I've done that for so long, and it hasn't made the pain any better. Maybe for a few minutes or an hour it goes away, but within that hour, I am letting it take control of me, and I am letting it take away everything that I want. I don't want to do that anymore, and I don't want other individuals struggling with this to feel as though they need to put as much pressure on themselves as I put on myself, because that's not entirely healthy, and I recognize that, and I'm doing my best to try and treat myself kinder. But I still push myself, and it's challenging, but in the long run, it has been worth it to put these challenges upon myself, because the accomplishment that I feel when I succeed at my goals, it does in a way make it worth it to go through these challenges while I'm in pain and to push myself through it, to see success at the end of it all. Makes it worth it to me. So all in all, I just want people to understand that just because somebody looks like they're doing okay or, looks fine doesn't mean that they are. And that can go for a whole slew of different things. That can be something that, defines someone with mental health issues. But in this regard, with chronic pain, no matter how young, how physically fit, whatever, someone can still be experiencing an immense amount of pain and just fighting through it. And it's hard, and it does feel lonely. But in a way, kind of like I had mentioned in the last sitting down and talking video, how I was in a way grateful for the bullying that I experienced. In a way, I'm grateful for the chronic pain because it makes successes taste all that much sweeter. And I think that it's made me stronger, as well as, like experiencing the bullying, more empathetic towards individuals, because you never know what somebody else is going through, and they may look fine, but on the inside, they may be in agony and just fighting to get through the next hour. So I really want people to know that it's okay to be in pain, and it's okay to take time to treat yourself for that pain, whether it's taking a bath, lying down, getting a massage. It is okay to engage in self-care. You don't have to constantly push and push and push. And I also want individuals going through this to know that they're not alone, and that I understand. And, my comment section and, messages on my Instagram are always open if anybody ever wants to talk about this. But I really just wanted to make this video, as one of the things that I go through, to make it a topic of discussion and to sort of share my story and let other people that maybe on the outside don't look like they're in pain know that I understand that they very well could be and are, and yeah, that you're not alone. So that's pretty much the end of the video. I really am thankful for anybody that's stuck through to the end. If you guys have any suggestions for topics that you would like for me to discuss, please leave them down below. I am more than willing to take a gander at that and try and work some topic into an upcoming video. And, I'm really appreciative for this new chance at a YouTube channel to sort of not only share singing, but also to share my own stories about certain topics. And it does feel nice to let it be known the things that I go through, because I feel like you wouldn't know it looking at me. And I think that maybe it helps people to think twice before maybe just judging an individual, to see me share my story and to know that others that look like they're fine might not be. I don't know. I know that this is a very, very small channel and that I get very, very small amounts of views, but my goal is always to try and help lessen the stigmatization of any of the topics that I discuss and to help make the world a little bit of a brighter place. So I hope that that was in some way accomplished. I hope that you enjoyed the video. Remember to like, comment, subscribe, and share, and I'll see you in the next one. Bye, guys.